Welcome back again. You're still watching us here on the Daily Debate. Now, we're going to talk about something very interesting because there seems to be a lot of integration going on now, specifically with this pandemic, making it very clear that the economic perspective can be very much interrelated with the health perspective. And we're going to talk more about the vaccinations, the fears of vaccinations, and what's going to happen in the upcoming period here in Egypt with this regard. I'm very much delighted to have joining me in the studio this evening Dr. Islam Anan. He's a lecturer of health economics, and he's also pharmacoepidemiology, and I hope I pronounced that right. Thank you very much for joining. Thank you very much. Dr. Islam, now, according to the head of the Central Department of Preventative Medicines, as we've seen in the report, Egypt is expected to be manufacturing 60 million doses of Sinovac or Sinovac, whatever way it's pronounced. Can you give us more details about the choice of this type of vaccination and the process that is going to be taking place?
Perfect. So to begin with, we do have a lot of options for vaccinations. We do have several platforms for manufacturing vaccines, which can be like Pfizer and Moderna, depending on the messenger RNA, or like Johnson & Johnson, AstraZeneca, and Sputnik 5, depending on the vector technology, or the basic classic way, which is like Sinopharm and Sinovac and the Chinese vaccines in general. And these are the easiest way to manufacture vaccines. And it's similar technology to the vaccines that we are giving to our children, the polio vaccine, for example. And that's why it's easily to be transferred. The technology and the manufacturing technology transfer is easy. We do have Vaxera in place. Vaxera is the place we manufacture vaccines in Egypt, and they do have the capacity to reproduce vaccines if we do have a raw material. And that's what's going to happen. We're going to get the raw materials from China, and then we're going to process it till we have the finishing product. So the choice of Sinovac is mainly because it can be fast in production. We do have the capacity building in place. The capacity assessment done by the Chinese experts were nice. We are able
which, pardon me, has been ongoing for several months, if not over a year, since the pandemic started. Seeing common visits going back and forth by the health ministries of both countries.
Yeah, from August 2020, they were visiting here to do inspection for the capacity assessment. So that's why. And the point of manufacturing itself is very important because we cannot depend on the timetable of the COVAX WHO because there's been a delay in delivering the vaccines to all the 92 countries depending on COVAX initiative. So we cannot just depend on whether we're going to get 1 million. Exactly. So saying that, we can have the power in our hands to give vaccination to 20% of Egyptians, which is the plan for 2021. And even though in 2022 we can start exporting to Africa and Middle East because we'll be the only country, and Algeria will come next in manufacturing COVID vaccine.
Now, bear with me, please, because this is a very interesting topic, and actually your title as well is very attractive. It's going to force us to ask questions that are of concern to the major public at this stage, who are very unaware of the nature of how this works. Now, my first question here is because you mentioned that the Chinese is the classic vaccine. If you'd be able to, at least in the least technical terminology way, explain what does classical mean, and why would Egypt go for that over the others? Is it the side effects? Is it the raw materials? Is it the fear of what it plays or hunts into the body? I mean, how does it work?
So that's a very good question, Yasmin. So let's start with the idea of vaccination itself. So what is a vaccine? So the vaccine is what you give to a body, to the immunity system, to recognize a virus in a later stage.
Foreign body is just the same thing.
Exactly. So if we can just make a figure of speech that the immunity system is like an army. They got soldiers, but they got tanks, and they got missiles.
Interesting way of putting it. Yes, it is actually very much. Yeah, that's how they would do the documentaries when we were young. Yeah.
So now if you are just letting the immunity system work on its own without vaccination, you will just wait for a virus, then wait for a couple of days because the immunity system is not going to be actually recognizing there's a foreign body unless there's spreading and replication of the virus. And this takes around 5 days with SARS-CoV-2, which is the incubation period, what we call incubation period.
5 days. So, and that came after, of course, the lots of tests and researches. So you assume that now we've reached this, and it takes 5 days for just, is it the symptoms in general now, or is it the virus vaccination, being inoculated with the virus itself?
We are now talking about an unvaccinated,
unvaccinated person
and infected with the virus, and it will take 5 days for the symptoms to appear. But the immunity system, because it will discover the foreign body very late, it will begin to defend it with the heaviest weapons, and that will affect the body, what we call a cytokine storm, and mainly most mortalities because of COVID is due to the immunity system itself, not because of the virus. So what we are doing is we are giving the immunity system an image, which is a vaccine of the virus.
It's like a picture, so you know what the enemy looks like, so you don't go on shooting everybody that just walks in.
Don't wait for 5 days.
Yeah, exactly.
Yeah, don't shoot with the heavy weapons. So that's the image of the virus. If you can see this virus, just kill it first day.
It's a very interesting way of doing it. I say why you're a lecturer, because I'm a lecturer too, so we speak in the same language here. Yes, it's very much
I hope it's easy and simple.
Very simplified. So that's basically what it does. But it still does show the same symptoms, because I've seen a lot of people who are saying, well, there are symptoms.
It's a very good point, because the symptoms we are seeing with COVID or with the vaccination, the common things is coming from the immunity system itself, not from the virus, because the immunity system will try to defend. So the first thing is to elevate the body temperature. Which is the same from vaccination,
or any virus you would get,
or the cold virus or the flu virus. And then shivering, being tired, not able to walk, just resting, because the immune system will like us to rest. So the war will be going on
easily without you moving back and forth, yeah.
So these all are the side effects, not from the vaccine itself, it's from the immunity system. We do have other side effects coming from the device, because we're injecting with the device, so sometimes you got redness in the shot area, and it stays like 1 day or 2 days.
But I think there's certain types of vaccinations that would do the same thing. I can't recall them right now.
The flu
but
one.
They would do, and even another one, I don't remember what it is. It also gives
redness.
It gets swollen up and things like that.
Exactly, yeah. And the third side effects are from the vaccine itself.
The vaccine itself. That's the thing. Let's get to this stage, because that's where Egypt decided, okay, let's go for manufacturing Sinovac. Although at the beginning there was a lot of discussions on whether Sinopharm is better or Sinovac is better, and a lot of people were very awkward towards the percentages of how it works. But now we see that things have changed with all the vaccinations that's ongoing, and they've decided to go for that. The choice in specific for that came under what circumstances?
We do have logistics choice, because we do have a deal with the Chinese plant. So that's putting first the capacity assessment for Vaxera, that we are ready now to manufacture a basic vaccine. And third is the production power. We can produce 20 millions from Sinovac. But if we are actually making technology transfer for AstraZeneca, for example, it may take us like 6 or 7 months just to begin production.
All right.
So we'll be faster in producing the classic vaccine. But in general, to judge the vaccines and the different platforms, whether we are talking AstraZeneca, we are talking Sputnik, we are talking Johnson & Johnson, because we're going to purchase from Johnson & Johnson this year, Egypt.
Seriously, yes, and that's like a new thing, new form of...
A new introduction for Egypt. And Sinovac, all of them, they give protection, and we judge vaccines on 2 types of protection. Protection from hospitalization, ICU and death, and protection from mild to moderate symptoms.
You're talking on the general perspective, of course, but there's always a percentage of those with special cases, chronic diseases
for all vaccines, they're going to protect the body against ICU, hospitalization and death with 95% efficacy. So it's a very good one. But the difference, and what we hear every day, which is 89% for AstraZeneca, 95% for Moderna, 98%
and it
for
changes,
Sputnik.
just like
Changes
just like the stock markets. You don't really know what percentage is going to work.
Yeah, because you have variants, you have new population.
And you have now, you monitor them on a longer period, so you see what comes up after several months.
Exactly, and here we are talking prevention of mild symptoms, mild to moderate, which is okay. Our objective from a vaccine is to prevent mortalities, deaths, not symptoms, because we have millions and billions of patients or individuals are getting colds every year. flu.
And it became so embarrassing to say you've got. I'm not sure what I've got. I think I'm fine. Otherwise, you know, it's just also.
AC.
We'll talk about the norms because that's something that's very interesting. Right before COVID-19, whenever we would even work in a working environment, when you know someone's got a flu, say, don't come and hug me or kiss me or shake hands. I've got a flu. It's okay. It's just a flu. Now, if you hear someone sneezing on the other side of the street, you just run away the opposite direction. We'll get to that, but let's talk about this choice itself again, the classical vaccine. And I'll tell you very interesting, because I heard a story today, two people were discussing, one took AstraZeneca and one took the Sinopharm, but when he told him why they were having this discussion, he said, well, because I'm asthmatic, so they told me, let's go for Sinopharm. So again, is the choice is it based on the individual patient's history, health history, or medications, or what basis would the government choose to give who what type of vaccines?
Okay, there's a protocol, and it's mainly depends on the decision of the physician staying at the vaccination center. So he is to decide based on the medical history.
I mean, after you submit the form with all the questions?
All the medical history, all the reports, whether the patient is controlled diabetic or uncontrolled diabetic, hypertensive, and so on. And then the physician there will decide whether you go for this vaccine, or maybe he will just advise him to wait, control your diabetes, for example, and return back after 2 weeks. So it all depends on the protocol followed by the physicians. However, for us, for the population in general, for the general public, we just say that both vaccines are okay for you. In clinical trials, they were both fine in terms of safety. So whether the physician at the vaccination center prescribed you to go for AstraZeneca, Johnson & Johnson, or later stage, Sputnik, or the Chinese vaccine, it's okay. All of them will be safe. All of them being tried with chronic patients, diabetic, even with autoimmune disease. Pfizer and Moderna, for example, we had in clinical trials patients with HIV, AIDS, for example, and it worked just fine. And from safety perspective, it was super. It was like 100% as a normal individual, whether gotten HIV or not. So the choice of vaccine, it depends on the medical history and the judge of the physician there in the vaccination center.
You said something about Johnson at a later stage. So because there's a lot of talk, especially and I'm talking from a global perspective, doses were even postponed. A lot of people around the world were inoculated with the first phase or first dose of AstraZeneca, and then there was a delay for the second dose time duration period, which is around 21 days, I believe, if I'm correct. And then when they said, well, it's okay, you can be inoculated with a dose from a different type of vaccine. And from here, people were a bit confused. Are you guys playing around? Are you guys experimenting us? What does that mean? And panic started. And since then, the wanting to go for inoculation went down the drain. And I'm talking global perspective. We'll come to Egypt because that's something to be studied on its own. Is it okay medically for you to be inoculated with two different types of vaccines?
That's a very good question. And that was actually initiated at the UK. And that was against all
who had a variant, by the way.
Yeah, exactly. And it was against all the recommendations from the scientists, because we always say that you need to follow the clinical trial protocol. If it's a first dose followed by a booster dose 21 days later, if you violate this table and period of time, you are actually deviating from the clinical trial protocol. So the company, even the manufacturer, cannot guarantee you the results. And that was then tried in UK and then documented, and they made a new clinical trial that you can separate between the initiation and the booster dose with 3 months.
3 months.
And they studied it for a couple of months, and they initiated the new papers that for
which is the type that they would say, even if a person gets the virus without inoculation, it's the time where you are to a large extent safe, assuming that you don't catch another variant that was not first
so far we don't have a variant resistant to vaccination, alhamdulillah.
Even the Indian one, because it's really going sad over there. We're talking about over 25 million people.
Yeah, so we do have two different types of mutation. So we do have spreading mutation, which is a mutation happening every day.
In the third wave specifically, it was very obvious around the world.
The virus circulating.
The whole family gets it, yes.
Exactly, and every time it circulates, every time the virus will mutate. And it's the nature of viruses in general. So that's a spreading mutation.
Viruses seems to be very clever. It's like they've got a brain that functions on the...
And that's why, for example, they mutate to be more spreading and not more violent. Because they know that if the virus will get more violent, it will kill their hosts. And
it needs to
dead as
camouflage
well.
itself, doesn't want to die,
And the
doesn't want
second
to die.
mutation, which is very important and didn't happen so far, is the mutation to escape. We call it escape mutation, to escape the vaccine. So far, we don't have any escape mutation.
Hopefully. Great. This is a very interesting. Time's flying up so fast, but I've unfortunately got to go to another report, so please bear with us. We're going to be back right after this.
A 205% increase in investments in the health sector was set in the 2021 to 22 development strategy as presented to Parliament by the Minister of Planning. The increase amounts to 47.5 billion Egyptian pounds, including the projects of Haya Karima or Decent Life Initiative, compared to 15.6 billion pounds in the year before. The plan entails expediting the construction of health establishments so 23 hospitals can join the service of the Health Ministry by providing them with ICU beds, incubators, child ICU units. All these and more will be made available at different public hospitals in 2021-2022 at a cost of 598 million Egyptian pounds. Nearly 1 billion pounds have been allocated to support the outlets that deal with COVID-19 patients to develop 23 lung and chest specialized hospitals, fever specialized hospitals, quarantine units and central laboratories across the country. In addition, 7 new university hospitals will be established as per the plan in El Gharbiya, in the Delta, and in Minya, Aswan, Asyut and Sohag in Upper Egypt. A total of 2.9 billion pounds have been allocated to develop 125 Takamul hospitals. Those are small hospitals in villages that provide basic health services to alleviate pressure on big hospitals in the city. The plan also covers developing 20 family development centers, 200 tailoring workshops attached to Takamul hospitals, as well as financing 350,000 micro-projects. Furthermore, the plan allocates 105 million pounds to cover 300 million women in terms of treating and diagnosing breast cancer. As part of the 3-year project to establish 20 centers to collect plasma to achieve self-sufficiency of plasma derivatives, 6 centers will be established in 5 governorates in 2021-2022 fiscal year at a cost of 650 million Egyptian pounds.
Welcome back again. You're still watching us here at the Daily Debate. Would like to again welcome very much my guest, Dr. Islam Anan, who is a lecturer of health economics and pharmacoepidemiology. Thank you very much once again. Seems to be very interesting. So much to talk about because there's a lot of concerns by the general public. One of them, and maybe we can shift to that now, the concerns of the general public. One of them is if I do get inoculated, do I have to quarantine myself? My immunity is going to be 0%. I'm going to contract the virus. I'm going to spread the virus. If I get the symptoms, am I going to die? And then there's this very thin line between panic attacks and psychological hallucinations, if you understand what I mean, and what's happening inside the body. Can you sort of explain medically exactly, or from a general? Yes. Let us know about this, because you've been inoculated, so maybe you can also share your experience.
So basically, to start with, vaccine is not a virus. You are not taking the virus. So
that's what everybody says.
Yeah, so the vaccine
and
is
it goes beyond that here in Egypt. It goes beyond that. They're going to, what do they call it? They're going to sort of like monitor you and...
microchip you.
Yes, and they're going to mutate you. And, you know, the Egyptians, they like to make imaginary stories.
And so why for they do that, you know?
I don't know. Maybe they want the world to rest in 1 billion and too much space to walk around. I don't know. But tell us about that.
If a patient or a general public, someone is taking the vaccine, he's not taking the virus. So if they got any symptoms, the symptoms is from the immunity system, not from the virus, because there is no virus. So the
is that medically true? The vaccination does not include any percentage of the virus.
It includes, I mean, it's not an active virus.
Oh, it's not an active virus, it's a dead virus.
So it's not going to cause a disease. So there is no disease from a vaccination. So a person vaccinated will not infect a healthy individual because he's not infected first place.
Okay.
And it goes beyond that, they are saying that if a patient is actually infected with COVID and he doesn't know, and then he went for his vaccination, he will die. which is a rumor as well, because it will never happen. If a patient is actually COVID positive and went for vaccination, nothing will happen from safety perspective.
But you're talking about those that are, they don't have symptoms showing, because obviously if you have symptoms, yes, you wouldn't go for it. So obviously...
If an asymptomatic person with COVID had his vaccination, it will not going to make anything from health hazards.
But does that mean that your immunity system is low because your body's still trying to detect what's going on? So you need to overprotect yourself during this period?
Yeah, the thing is the vaccine will not going to work as effective as with a healthy individual. It will just be less effective, but nothing from healthy perspective, nothing from safety perspective. And then you don't need to isolate yourself. It's just 48 hours, your immunity system
I've heard as far as 21. I've heard a lot of stories that are just very scary.
The immunity system is printing the image.
That's all. It takes its time, yes.
Yeah, it takes like 48 hours. In the 48 hours, you need just to take paracetamol, and that's it. And they are saying that you cannot take paracetamol because it will not going to make the vaccine work. It's okay.
Oh, no, I haven't heard that yet. So
they can take any anti-fever and they can take paracetamol. It's okay, nothing going to happen. And control the symptoms, rest for 48 hours, and that's it.
That's it. Now, the flow of people wanting to fill in the forms and wait for the turns and go and be inoculated has been noticeably increasing, specifically during the past couple of months and the third wave. But when the whole world started talking about vaccinations, even when it did come to Egypt, they were like literally speaking on television, people go and get vaccinated, you're in another world. And nobody even mentioned, even on a social level, the story or spoke about it. And then they started speaking about it, and then they started being concerned on go first and then I'll see. And now we're seeing even younger generations flocking into it. So let's talk about what happened here. Is it a cultural perspective and now it's into an actual actions, or is it a trust issue? What is it? Is it a psychological thing?
So let's start with anti-vaxxers and people against the vaccines.
In general.
In general, it's a movement which has been for 100 years since the invention of vaccine, and they are against even polio vaccine.
Oh.
So they
and
don't...
children vaccines.
Yes,
and all
the children mandatory vaccines. They are not giving it to their children. So this is one story. However, at COVID situation, they started to speak a lot about don't get vaccinated. It will give you a long-term safety hazards. You'll get a lot of diseases after 20 years. However, there is no single evidence that any vaccine in history caused a long-term safety hazards or safety concern. And moving to what's happening, why people got any concern here, because we know that the manufacturing and the research and development of vaccines, it takes like 10 to 15 years.
Exactly.
And we finished in 1 year.
Yes, so that was the main fear. The virus is new and everything because we've seen vaccines happen every 100 years, the Spanish flu and I don't know what else. And so it took years before they started reaching to a compromise of not just the vaccination, but also medications and protocols that are fixed. So people are very confused on how fast the whole process went.
However, the answer is easy because we didn't cut corners in phases. We do have a preclinical phase to test on animals, a phase 1 on human, phase 2 and phase 3. We didn't cut any corners. We finished all the phases. However, it was faster. Why? It's very easy. First of all, it's fund. We've never in history, research and development have been funded.
Yes.
Exactly, billions of dollars. So that made things faster. Second thing is...
Technology, definitely.
Yes, technology, it was the second one, technology, because you can now link all the research centers around the world in just one click. And third is finding volunteers. Imagine during Ebola time, to find a volunteer to take a vaccination against Ebola. However,
I mean, they would stay away from their own family members because they're scared, so they wouldn't go and put themselves into this.
Exactly.
But now that, yes, they haven't it. We've seen in the United States, I believe, they were the first country that was, they had a lot of volunteers, and maybe that's why they started at a much more earlier stage.
So all the phases happened quickly. However, we didn't cut any corners. We didn't deduct any phase during the manufacturing. So
there's no relationship between the virus itself, which again is a very controversial issue because a lot of doctors, they believe that COVID-19 or SARS-2 has always been there, but it's just that the fast spread of it caused the world to, and pinpointing at a certain country in charge of spreading it, have caused these tensions. However, if it wasn't highlighted by the media, people would not have concentrated so much on it. Is that true?
I don't think so, because we all have family members who've suffered from COVID or died from COVID. That didn't happen with with H1N1, with H1N5. Didn't happen with any coronavirus, with SARS, with MERS. The spread is actually much faster. And being a symptomatic carrier, that was disastrous. That caused the pandemic. A person who's got COVID and asymptomatic, he doesn't know, all the people around him, they don't know, and he starts spreading the virus. So I believe it is a pandemic, it is severe, it needs a lot of effort, and we can see that the world is not united against the vaccine, against the virus, and currently we have a problem of health policy, and some countries got 0 vaccines, and we can see the impact of that. Like in India, we have a new variant spreading again. If we do have justice and no vaccine nationalism, we wouldn't have seen mutant or a variant from
Seriously,
India.
I had no idea. It did happen. That's what happened in India. It's not because it was a public mass celebration, of course, but because they are a community that's against vaccination. Because a lot of people were expecting that India would be the second country after China to actually manufacture mass vaccines, but that didn't happen.
They were producing for
others. So
it's
a cultural thing. Oh, but they didn't do it for themselves.
When you look at the India crisis and with the health official there, they didn't book for themselves vaccines. They were manufacturing vaccines for Europe, for US.
It's an economic pure thing, but not a health concern priority.
So if you have vaccinated 20% of Indian population, you wouldn't have seen a variant, for example.
That's interesting. I want to ask you this question next. Now, the importance of vaccinations, what does it do at the long-term effect? If part of the population is, a very large percentage is inoculated, and the other part has already had the virus at least once, or asymptomatic, as you've said, what happens in a couple of years? Will that be a normal norm, or will the vaccination process needs to be ongoing, just like the seasonal flu vaccine, where you have to do it every season?
Yeah, that's a very good question, because if we have fair distribution of vaccines, we can end the pandemic in 1 year. It means that during 12 months, to vaccinate 70% of population. Because at this time, you will do have a herd immunity, and the virus will just fade away.
So does herd immunity, is it a terminology that actually exists?
Yes, but used by vaccines.
Not by getting the virus,
yes,
and being cured.
The antibodies will just stay for 3 to 6 months.
And they'll forget the face, the image,
exactly.
and you'll have to remind them again. Yeah.
So you need to depend on vaccine, which is give actually a good image that lasts for at least 12 months. So, however, what we see from the world now is that you're not going to be able to end it in 12 months, because you do have a vaccine nationalism, and some countries are actually warehousing and stocking vaccines that can last 3 or 4 years, like Canada, like Japan, and so on. So some countries got, in Africa, for example, most countries got 0 vaccines doses so far. So we need to vaccinate at least 20% of any country to decrease mortality by 88%.
I know
and
this
we
is
can
a bit,
see it in UK.
Yes, I know it's a bit diverted political, but we have a minute though. But the fact that Egypt is very concerned not just in inoculating its people, but also the well-being of Africa, maybe that's what we've seen very much echoed in President Sisi's visit. How do you evaluate the government and the administration and political leadership view and vision and strategy concerning the pandemic? And I'm very sorry, you just have 1 minute because we have to go.
Very quickly, I think that we can be the gate of vaccinating Africa. And if the European and American countries are not collaborating to give Africa a vaccine, I guess we can be a good hub. We've been the oldest manufacturer of medications and vaccines. We are the #1 producer of medications and vaccines, and we can be the #1 exporter to the COVID-19 vaccines to Africa. I guess we can end the pandemic, at least relieve the pandemic in the Africa continent, and it can be of economic benefit as well.
Of course, definitely. Thank you so much for coming in, Dr. Islam Anan, Lecturer of Health Economics and Pharmacoepidemiology. Thank you so much. That was very interesting, Very well said, and it is important at this stage that people are now changing their culture and being very much aware on the need that vaccination is an important part of getting rid of this pandemic, so that everybody can take off their masks and live normally and go back to schools and do our work and not be isolated. So thank you so much for that.
My pleasure, my absolute pleasure.
Our episode has been unfortunately ending. Time flew so fast, but we will be, of course, discussing that in the upcoming period as Egypt starts going into concrete steps with the manufacturing of these vaccines. I'm Yasmin Bakir signing off. Thank you for watching.